The St. James Health Department is seeking to clear the air this evening about reports of an outbreak of hand, foot and mouth disease in the parish. This as news of the outbreak is causing jitters among some parents who've been anxiously awaiting the resumption of face-to-face school. Shamela Pullen has the details.
Concerns in St. James ahead of the start of the full resumption of face-to-face classes about mounting cases of hand, foot and mouth disease. The St. James Health Department has confirmed that since the end of January, it's received several reports of cases. Acting Chief Public Health Inspector for the parish, Sharika Lewis, says they're from at least 4 schools.
1 daycare facility, 1 children's home, and 1 preschool that was affected. So in total, we have about 16 students or children that have since been affected. And good news is that the infections in these children have since then subsided and the children are on the road to recovery.
She was, however, quick to point out that there isn't an outbreak. Hand, foot and mouth disease is a mild, contagious viral infection common in children between 0 and 5 years of age. It is characterized by sores in the mouth and a rash on the hands and feet. The virus is highly contagious and it can be contracted by person-to-person contact. It's why Ms. Lewis is urging students to be careful when classes resume.
So you see, we're in the schools where children are coming out now face to face, that their interactions and the close proximity of children can result in a rapid spread of this virus. You have fecal oral route, meaning that due to poor toilet training or lack thereof, children should be encouraged not to put their hands in their mouth, especially after they have used the toilet.
And Ms. Lewis says the health team has been doing routine inspections since August of last year, and this will continue.
Especially those that have indicated that they are reopening. So we have been going to schools on a daily basis, doing daily monitoring for COVID-19, and we are doing a thorough inspection. So we have an institutional health specialist who is quite vigilant, and the officer has even assisted school administrators in developing cleaning schedules.
Shamela Pullen, TVJ News.